Hey guys, I hope everybody is staying warm as they can in these frigid temperatures. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to go over sudden knee pain without injury. Happens a lot and it's very difficult to figure it out, honestly, because what happens is your knee has no real specific muscles that attach only at the knee. So I always call the knee the hub because everything that attaches at the knee also attaches at the hip, also attaches at the ankle. So it really absorbs a lot of dysfunction from the hip and the knee. The hip and the foot. So let's say you're flat-footed, that can cause issues at the knee. Let's say you have weak hips or a weak core, that causes issue at the knee. Now you do have a meniscus at the knee that's only at the knee, and you do have some ligaments that only exist at the knee, but a lot of times when you're talking about sudden knee pain with no injury, you're not dealing with anything like that. When I talk about an injury, I'm talking about falling down the steps. I'm talking about you ran and you heard a pop. I'm talking about slipping and falling. Something traumatic, something that you know you did. That's what I call an injury. So when you injure yourself and you have that traumatic event, you know where that came from, you know what happened, and a lot of times that can involve a ligament at the knee or that can involve that meniscus. But if you just have sudden pain in your knee, generally that's coming from somewhere else, and the part that's very difficult is to figure out exactly where it's coming from. And most of the time, it's not coming from any one spot. It's coming from a bunch of different spots. Now, a lot of times, sudden knee pain without injury is not truly what happens. As I dig further, most of the time people can recall a time or sometimes where they pushed through the pain or it was uncomfortable. For example, runners do this a lot. It will be uncomfortable running for the first mile and then it goes away. You're walking down the steps, it's uncomfortable for the first 3 steps and then it goes away. Well, what happens is it doesn't go away. You wind up compensating for that. And over time, whatever you're compensating for continues to build. And now, all of a sudden, instead of being uncomfortable, it is absolutely painful. And it feels like you've injured your knee, and you didn't actually injure your knee. That little uncomfortableness, that little nagging pain, that little nagging ache just all of a sudden came to fruition because it was being compensated for so long it could no longer compensate. So we see this, again, I use the running example only because I've seen it so many times where people run the first mile or they limp the first mile, kind of push through it, and then, it's totally fine, and then they get to race day and they literally can't run. They're in tremendous pain. So when I talk about compensation issues, a lot of people are like, compensation issues. They can be debilitating. They can absolutely stop you in your tracks. They can cause you to fall to your knees. They can cause stabbing, excruciating pain. Because what happens is the muscles get so tight and they wind up with all these knots and they're so tight that they literally cause pain. They can't function correctly anymore and they just stop. And it just sends all of these pain signals to your brain where you have to just literally stop. Sometimes you fall down. It'll bring tears to your eyes. So it is important to understand that while you may not have had an injury, so to speak, this pain can be tremendous and it will absolutely stop you in your tracks and you may need to ice. And this is a lot of times when people start to seek treatment, and unfortunately this is when the treatment takes a long time. Instead of waiting or instead of addressing it before, you wind up being here longer and spending more time and more money because you didn't address it when it was just a nagging ache, and you didn't address it when it just hurt a little bit or it went away. So it's very important to make sure that you address any sort of nagging ache or pain when it comes up, when it happens. If you notice the first steps in the morning are painful, it doesn't go away. You wind up compensating for it. Now, what do I mean by compensation? Well, at the knee, there are several compensation strategies that you can do. If you're flat-footed, for example, I am extremely flat-footed. What happens is this knee will go in like this. You're going to put tremendous amount of pressure on the outside of your knee, on the back of your leg. If you wind up not addressing the fact that your foot is flat and you're continuously running on it and you don't have proper shoe wear and you don't wear orthotics, you're going to continuously have to compensate for the fact that your knee is going inward. So these muscles are going to have to pull harder in order to stabilize your knee. And this is repeating itself every single time you take a step. So over time, you are compensating. You are pulling out these muscles. Now, you don't know you're doing this. But if you don't address what's going on and you don't strengthen the right muscles and you don't foam roll, you're going to wind up with some very serious IT band tendonitis, some calf pain, probably some foot pain, but it's probably all just going to feel like a lot of pain at your knee. And until you get it addressed and until you figure out exactly what's going on, that's what it's going to feel like. Same thing from the upper side. Let's say you have weak hips and you can't stabilize. Like if you watch yourself walk down the steps, a lot of times people's knee will go inward. Now, that's a really gross exaggeration of what it may look like, but very few people will go down and have their knee just stay right over their toe as it's supposed to. A lot of people will collapse in because that's a little bit weak up there. So every time you go down the steps, you're doing this. Well, obviously you don't fall inwards, so you're compensating and the leg is pulling outside, or these muscles are going to work harder to pull outside. So it's very difficult to say, yes, this is exactly what's going on when you have a knee pain without injury. Most likely, 99.9% of the time, it's a compensation issue. The difficulty is figuring out exactly what that compensation is. You can be compensating in your calf muscle because you have plantar fasciitis or because you have weak foot muscles. You can be compensating in your hamstring. Hamstring pulls are a very, very big precursor to having some significant knee issues down the line if you don't address them. And hamstring issues are one of those things that come and go. You feel them one day, you ignore them the next, they go away within a couple weeks, maybe some Advil, maybe some ice, maybe it was just a pulled hammy. And all of a sudden, here we are months and months later, maybe even years, and you are winding up with severe pain. So you have to understand that it is very important when you feel a nagging ache that doesn't go away, or a nagging ache that goes away after a period of time, it didn't go away, you just compensated for it. And eventually that compensation is going to result in a very severe pain. Is it going to take months? I don't know. It can take days, weeks, months, years. It depends. For another example, like when you're moving around in your chair because you can't sit still, that's a compensation pattern. You're using muscles that shouldn't be used in that manner, but you're moving around and you're trying to compensate. So there's a lot of compensations that go in your body that you are unaware of. Most compensations, you have no idea that you're doing them. Your body just naturally does them. So you have to figure out exactly where that compensation issue is coming from. One of the ways you can start and maybe feel if you have some sort of issue going on is just kind of check your IT band. Take your hand, push down on the side of your leg. Do you feel any knots? Do you feel any tender points? That could be the start of some of that knee pain. Then you try your groin. Do you feel any tender spots in there? But again, it's really difficult because that knee being the hub of the foot and the hip, chances are if you have severe pain, all of a sudden it is something going on above and below the joint that you're going to need to address. So it's really important to know that if you're getting a consistent pain when you're doing something or a nagging ache, and I know I hear all these different words to describe it. Oh, it didn't really bother me. It was just a little nagging this. It was just that. If I kept doing it, it would go away. That doesn't go away. You compensate for it. And this is where sudden injuries happen. Sudden pain without injury always is some sort of compensation. So make sure that you are addressing any pain that you have. I understand that as we get older, pains start to happen more and more. I wake up every day, something hurts. Does it go away right away, or does it last? Am I consistently feeling something? Pains where you wake up and it goes away, you're good. But if you're waking up with the same pain, or you take the first couple steps, you're walking down the stairs, and you notice there's an ache or there's something not right, that's going to turn into something that's going to be extremely painful down the line. That's going to turn into something that can cause you severe pain. So don't ignore that little aches or just pop the Advil or put on the ice. If it goes on for 2 weeks or more, you really need to focus on that and find out the cause of the issue, because finding the cause is how you fix it. Just doing something in your knee, just putting ice on your knee, just putting tape on your knee, putting a sleeve on your knee, doesn't do anything. It's not going to address all the compensation going on above and below. It'll feel better for a little bit. It'll give your knee a nice little hug, but it's not going to fix anything. You've got to address the problem. I say this over and over in our videos. If you haven't checked out the rest of them, they're on our YouTube channel, Total Performance Physical Therapy, but you have to address the cause of the pain. Treating where the pain is half the time is not going to work. You've got to address where the origin of that pain is coming from. If you or somebody you know is suffering from knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.